Hello everyone, and as you might be aware, there's a big disparity gap in diabetes care in the minorities population, including the Latinos. I am one of the pediatric endocrinologists at the Barbara Davis Center, and we've been trying to close this gap. Some of the strategies that we've been implementing is the Barbara Davis Center Latino program, which is a culturally sensitive, language-appropriate group visit appointment with tailored materials to try to improve care in all of the patients that we serve. We have had great success in terms of increased technology uptake and improvements in A1C. There's a lot to be done. We try to implement telemedicine, and we found also a lot of challenges with our Latino population, with lack of understanding in the technology, but also not able to obtain data. There's a lot to be discovered of how we can adapt telemedicine to better serve underserved communities. It's been my lifelong passion to bridge this gap. At the Barbara Davis Center, we have implemented group appointments. We started by doing culturally sensitive materials that are really adapted to our patient needs. Through these groups, the patients have a lot of peer-to-peer interaction, which have seemed to improve their openness about their challenges. We have great satisfaction data and retention data, which is great. We have been able to evaluate some of the barriers associated with socioeconomic status, with literacy and numeracy. We have better understanding of how these families go home and sometimes are struggling to care for their families and their child. We have a lot of better outcomes nowadays, but there's still a lot of work to be done. Yeah, so through the Barbara Davis Center group appointments, we have been able to increase technology uptake. Nowadays, we know that diabetes technologies are life-changing. They provide better quality of life and better diabetes outcomes. We understand that Latinos have a harder time uptaking diabetes technologies, and through these group appointments, we have been able to increase their uptake of both continuous glucose monitors and insulin pumps. And after that implementation of newer technologies, we have seen an improvement in A1C and other outcomes like quality of life. As future steps, we're evaluating challenges and barriers associated with staff and providers. Once we understand what those barriers are, we're going to implement newer strategies to provide better skills to providers and continue to do better care for our patients and families.